Oregon's healthcare system has been broken for a long time. Our pleas for changes to make the system patient-centered have been ignored by hospital executives for decades.
Matt Calzia is a registered nurse and a practice consultant with the Oregon Nurses Association, or ONA. He and his colleagues say long-standing staffing issues are exacerbated by the pandemic.
The despair on the nurses' faces and the fatigue, it's more profound than I've ever seen that.
And the burnout is real.
85% of the nurses at OHSU have indicated that they are unable to use vacation time or take a mental health day because there are not enough nurses.
Perhaps the most concerning stat, Calzia says, 60% of OHSU's nurses are considering leaving the profession entirely. And he says that percentage is reflected at the national and state levels, too.
Losing even a single nurse from the bedside will result in greater strain on.
While Linda Pond, ONA president, says more than 90% of ONA nurses are vaccinated, recently large healthcare systems like Kaiser Permanente and Legacy Health have put thousands of staff across the country on leave because they don't want the COVID-19 vaccine.
As we see some small number of nurses potentially leaving the profession due to their decision to decline vaccination, we are also concerned that burnout will lead to an even larger number of nurses leaving the bedside.
Natasha Schwartz, a registered nurse at OHSU, along with her colleagues at the ONA, say the bottom line is the staffing crisis needs fixing, especially as the pandemic stretches an already stretched system.
It's just compounding the work day after day after day, compounding the trauma. That's what the moral injury is that we speak of. That is what is driving nurses away from the profession that they chose and the profession that we love.
Nurses we spoke to say they want two key issues addressed. First, ways to retain nursing staff, as well as more support for nursing education and ways to attract new nurses to the profession. About that retention piece, they want hospitals to honor breaks for nurses who often may work 12-hour shifts with no break. Because at this point, if they do take one, they've got to find another nurse to care for their patients, which doubles that nurse's workload. We'll have more details about their call to action on our KGW website. Christine Pitawanich, KGW News.